Did you know your brain processes pain signals faster than you can blink? Or what about the heart's role in pain? Can emotional trauma cause actual physical pain? We're weighing 6 common pain misconceptions against the facts. Let's get started. Okay, pain's definition has gone through a couple of revisions since we first officially defined it in 1979. We know more about it, and research and advancement has really come a long way, so we're better at measuring it. So as of 2021, the updated definition is an unpleasant sensory and emotional experience associated with or resembling actual or potential tissue damage. But all pain is not created equally, is it? Pain misconception number 1, there's only one type of pain, and it's physical. Now, saying pain is a purely physical manifestation neglects the intricate connection between the physical, psychological, and emotional dimensions of human experience. Pain is not just a straightforward signal of tissue damage. It involves a really complex network of sensory, cognitive, and emotional processes. And there are actually 15 different types of pain. 15 different types. Acute pain is number 1, and this is usually sudden onset, short-lived, and directly related to tissue damage or injury. In contrast, chronic pain lasts for an extended period, typically beyond 3 to 6 months, and it can persist after the initial injury or without any apparent cause at all. Nociceptive pain is number 3, and this is caused by tissue damage or inflammation, and it has a protective nature, signaling potential harm. Now, here we need to differentiate between the generally used term pain and nociception. Nociception, because the two are often used interchangeably. Nociception is the body's ability to detect potentially harmful stimuli through specialized nerve endings called nociceptors in our skin. And this helps the body respond to potential threats by sending signals to the brain about actual tissue damage or impending injury. And I've probably mentioned it, I think in a past video, I definitely mentioned it in a past video. Schoolhouse Rock. I forget which one it was, but oh my God, it was the nervous system. Ugh, I actually even sang Schoolhouse Rock at the end of the video. I can't remember the name of it. But anyway, an example of this is when you touch a hot stove. Nociceptors in your skin send signals, triggering the reflex to withdraw your hand. And this happens quickly. These impulses travel 5 to 30 meters or about 40 inches per second, which is faster than you can blink. Pain, on the other hand, is a subjective and conscious experience that happens when the brain interprets those nociceptive signals as unpleasant or harmful. It is not only a sensory experience, it also involves emotional and cognitive components. So take that discomfort and burning sensation after touching the hot stove. That is the experience of pain. It goes beyond the initial nociceptive signal to involve your conscious awareness of the sensation. Neuropathic pain is caused by damage or dysfunction of the nervous system. This is often described as burning or tingling or shooting, and examples of this include diabetic neuropathy and sciatica. Visceral pain originates from internal organs, and it's often described as deep, dull, or cramp-like. And because we have so many organs in one area, like take for example your abdomen, it can be really, really difficult to localize. How many of you have had an appendicitis? I've personally never had one, but I've treated plenty of patients that were having one. And I have a really good story. I used to date somebody, and we were in California. I was in a movie theater with him, and he had a full-blown appendicitis attack. Yeah. Anyway, so yeah. And if you've ever experienced this, then you know that initially the pain probably started someplace entirely different than what you expected, probably behind your belly button. This is also called referred pain. Somatic pain originates from musculoskeletal tissues and is described as sharp or throbbing. This is a lot easier to localize compared to the visceral pain we just talked about. Next is referred pain, which I just mentioned with appendicitis. This is felt in an area distant from the actual source. And another example of this, because I always like to give you more than one, is when somebody has shoulder pain when they're having a heart attack, right? You've heard that. So men tend to, I think, have referred pain to the shoulder. Women tend to have back pain with heart attack. You can also have abdominal pain, all kinds of weird pain you can have with heart attack. So that's why a lot of people will come into the ER and, they're having severe abdominal pain, and it turns out that's what it is. They're having an active heart attack, or vice versa. They're having chest pain, turns out to be their gallbladder. Yep, this is common. Next is inflammatory pain, and this is self-explanatory. It's the result of inflammation in the body and is often associated with conditions like arthritis. Ischemic pain is caused by inadequate blood supply to a tissue or organ and is commonly seen in conditions like angina or chest pain. Breakthrough pain is an intense and sudden flare-up of pain, and it occurs despite ongoing pain management, and this is common in cancer patients. Cancer pain arises from tumor growth or cancer-related treatments. Postoperative pain is next, and that's pretty self-explanatory. It's post-op surgical pain. Phantom limb pain is pain that's perceived in a missing or amputated limb. Central sensitization is amplified response to pain due to changes in the central nervous system. And a hallmark condition in this category is fibromyalgia. And then finally is psychogenic pain, which is an outdated term denoting pain with a psychological origin that doesn't relate to physical damage. And examples include something like somatic symptom disorder. And we've steered away from this term because it has a negative connotation attached to it that incorrectly may label it as less than or not real in some way. Which brings us to the next misconception. Emotional pain does not cause real pain. Anyone who's ever gone through a breakup, divorce, lost a loved one, or a pet, or a job has heard the term broken heart or described it as soul crushing. And these aren't just metaphors. This form of pain originates in your brain and happens because of a combination of factors, including mental health, personal history, or other health conditions. And while psychogenic pain may not have a direct physical cause, this pain is very real and feels the same as physical pain. Pain is subjective. Pain is subjective, meaning how you experience it is unique and nobody else experiences it quite like you do. So,
you are a pain unicorn.
Factors that play into this can also include genetic mutations, medical conditions, state of mind, culture, childhood trauma, and even PTSD. Even when pain happens without nociception, your brain still processes it the same way. That means this can manifest as back pain, abdominal pain, chest pain, etc. All of it is recognized and interpreted by our brains the same way. So let's take an anxiety attack.
Oh, that's not.
Anyone who's had one knows that you may feel anxious on the inside, but you also experience increased heart rate, sweating, shortness of breath, shaking, etc. This is completely out of your control while it's happening and can be categorized as painful for anyone going through it. Everyone learns the application of the word pain through experiences related to an injury during childhood. It is without a doubt a sensation in the body, but it's also always unpleasant and therefore also an emotional experience. The next pain misconception There's no such thing as a broken heart. Beyond pumping blood, the heart plays an active role in pain perception. It's like a conductor orchestrating the body's symphony of sensations, and it's the source of emotions, desire, and some even say wisdom. In 1991, Dr. Armour discovered that the heart has a little brain. Where have I heard that before? Or what he called the intrinsic cardiac nervous system. And this heart brain has about 40,000 nerves, so it has its own nervous system. Now, the heart talks with the brain in many ways: neurologically, biochemically, biophysically, and energetically. The vagus nerve relays information back and forth between the two. And because of the pathways, the heart sends more signals to the brain than the other way around. Research has demonstrated that pain perception can be regulated by targeting the heart using techniques like vagus nerve stimulation. And these methods seem to bring about key changes that occur in the brain regions and are involved in the cognitive and emotional factors of pain. Interestingly, there is a condition called stress-induced cardiomyopathy, or Takotsubo Cardiomyopathy, also known as broken heart syndrome. And this is a reaction caused by a surge of stress hormones, which causes a part of your heart to temporarily enlarge and not pump well. It is usually treatable, and most who experience it make a full recovery within a few weeks and are at low risk for it ever happening again. Although, in some rare cases, it can be fatal. So, you can die of a broken heart. Rarely, but you can. The heart also releases oxytocin, also known as the love hormone, which can act as a natural painkiller. Ever been in pain and family comes to visit and you feel better? Or why do we all want our mom when we don't feel good or we've hurt something? Because moms are the best source of love and apparently oxytocin. I want my mom. I want my mom all the time, especially when I'm not feeling good. Yep. True story. I had just had my youngest child, who was a newborn, and I had my two others that were toddlers. I was deathly ill with the flu, deathly ill. And all I could hear was my husband just struggling to manage a newborn baby and two toddlers over a weekend. And I remember laying in bed and calling my mom, even though I had a fully capable adult in the house with me. I was so sick, calling my mom and crying, saying, "You need to come. You need to come." And she dropped everything and came up to my house. And as soon as she walked in the door, as soon as I heard them arrive, I was able to relax and sleep and recover. Before that, no, it was not happening. Anybody who can relate, drop it in the comments. Pain misconception number 4, weather has no effect on pain. So research still hasn't confirmed a cause and effect link between weather and joint pain or muscle aches, but it's believed that changes in barometric pressure can trigger these sensations. Less air pressure surrounding the body can allow muscles and tendons around the joints to expand, which can increase pressure on them, possibly leading to pain. Another possibility is that when it's cold or damp outside, you really just want to couch surf for hours and watch movies or play video games, and this can lead to joint stiffness. When the weather heats up or a high-pressure system moves in, the increase in barometric pressure usually brings relief. And this is why a lot of people that suffer from arthritis and fibromyalgia, things like that, will move to warmer climates, because they do better down there because of that. Also, if you're expecting discomfort when the weather shifts, you may just notice joint aches more than you would otherwise. So to ward weather-related pain off, move around, do some stretching, just don't be a couch potato. Don't be a couch potato. Pain misconception number 5, If you can't find the exact cause of your pain, it must be in your head. Many symptoms of pain are not correlated with findings on any medical tests or scans. And there's a nifty term for this, which is medically unexplained symptoms, or MUS. Just because a clear cause of your pain isn't showing up, it doesn't mean that your pain is not real. Many people with chronic back pain have absolutely nothing on their MRI scans, and the opposite is also true. Many people will have really significant findings on MRI imaging, like really, and report nothing, not a thing, no back pain. Now, there are several different ways patients make sense of pain. The most widely used model is the common sense model, and I'm not joking, it's actually called that. It contains 5 categories: identify, cause, timeline, consequences, and controllability. So it's processed both cognitively and emotionally. It implies that patients seek to identify the name of the condition that causes the symptom, its cause, how it will run its course, its consequences, and how to control it. Pain misconception number 6, redheads have a higher pain tolerance. This is one we've all heard variations of, and I've heard both, that they have a higher pain tolerance and that they have a lower pain tolerance. But according to the National Institute of Health, there are certain nuances to this claim. Pain tolerance is the maximum amount or duration of pain that someone can endure before seeking relief. It is a measure of how much discomfort a person can handle before the pain becomes intolerable. Pain threshold, on the other hand, refers to the point at which a person first perceives a painful stimulus. It is the minimum intensity or amount of stimulation required for someone to recognize and acknowledge the presence of pain. Redheads may be more sensitive to certain types of pain and can require higher doses of some pain medications in certain situations. However, studies suggest that their general pain tolerance may actually be higher. People with red hair also respond more effectively to opioid-type pain medications requiring lower doses. So if you have red hair, one study found redheaded women were more sensitive to temperature-related pain, and that the nerve blocker lidocaine was less effective in managing their pain than that of dark-haired women. So I guess I'm out of luck. Another study found that redheads were less sensitive to pain from electrical shocks than other people. How the heck did they test this? I don't know, how did they test this? This is because they have a variant of the melanocortin 1 receptor, or the MC1R gene, which controls the production of melanin. Also, they tend to require more anesthesia compared to people with non-red hair. So, speaking of pain, check out this video on the top 7 most painful surgeries and my response to comments. I got a lot. I'll see you there.